Hi, this is Pat Sharp. I'm the clinic director at Neuro, and we're doing a little series of informational videos about different kinds of learning disabilities. So this one's on dyslexia, and this is to kind of highlight our learning clinic department because we do a lot of treatment for reading and other kinds of learning disabilities. So today's little offering is I wanted to share with you some warning signs to watch out for in terms of may it be possible that your little person or big person for that matter is experiencing a form of dyslexia. So there's many symptoms to kind of watch out for, and the earlier you can identify that a problem does exist, the better the outcome will be. If you wait until he or she is 15 years old, there's a lot of other compounding factors, including just a wretched sense of self-competency or not feeling like a competent learner that can compound into way other areas of life in addition to just school. So the whole point of this is to focus instruction for what works, what neurocognitively works for a person with a reading disorder, and not waiting on thinking that, well, maybe it'll get better with time. If any of these symptoms are pretty prevalent and beyond, just kind of ordinary, it's something that needs to be evaluated, which makes great sense in terms of the big picture. So early on, around ages 3-ish to 5-ish, and this doesn't necessarily have to be nailed down to a birth date, but around those ages, your little preschooler should be interested in playing games that have language sounds as part of them. For example, repetition, saying things over and over and over again, rhyming and saying rhymes over and over again because they're pleasing and pleasant to the child, and he can do them or she can do them. Do they have trouble learning nursery rhymes like Humpty Dumpty, sat on a wall, or Jack and Jill went up the hill? You can see those are kind of rhyming, language-based things, and most little preschoolers can rattle those off if they've heard them, of course. That's the other factor. Do they frequently, even at age 3, 4, 5, mispronounce words like paschetti for spaghetti? That's fairly common for a 3 to 5-year-old, but that's kind of the idea. The other factor would be that they would persist in using baby talk way past the time when they need to be using baby talk. Do they fail to recognize the letters in their own name? And this not so much at age 3, but certainly by age 5, if they're not recognizing the letters in their name, depending on how long their name is, certainly the first letter in their name should be recognizable. That can be a signal. Any one of these, by the way, by itself means probably nothing, but all of them in combination probably means watch this, watch to see, but not too much longer, because most children learn to read somewhere between the age of, at the very earliest, 3-ish. That's very uncommon. More likely it's between 5-ish and 8-ish. And if reading's not real fluent and easy by 8-ish, there definitely is something about the neurocognitive structure of that person that's making learning how to read more difficult than it should be, because the way in which they're trying to be taught probably doesn't match what their neurocognitive strengths are. So the last tip for the preschool age kiddos is having trouble remembering the names of letters. And you've all got those little magnetic colored stick-on things that go on the fridge, or the blocks with the letters on them. And they should be able to start learning the names of letters and numbers or days of the week and just recognizing them kind of as a whole gestalt and how they look. So moving up to kindergarten-ish age, 5 to 6, are we having problems recognizing and writing letters or writing his or her own name? They should also be using some form of invented spelling by now, where there's some dependence on the sounds, but they're not necessarily all, the letters aren't in the same right order, or some of the sounds are omitted and some sounds are put in letters. But that kind of invented spelling is very normal at this age. Do they have trouble breaking up spoken words into syllables? Like if you said cowboy, can you say it as 2 words, cow and boy? And then you give them the idea, and then you maybe would say something like, now do it with butterfly. And if they can do butter, fly, then they can do this. If they can't do that, then you know that something's going on. Do they have trouble recognizing words that rhyme? Like if you give them 2 sets of words and you say, do these rhyme or not, and you teach them what rhyming means, and they can't tell that cat and bat rhyme, then that's a signal that something may be awry. How are they doing with connecting letters and sounds? Like if you were to say to your child, what does the letter B sound like? Or what does the letter M sound like? They should start to be able to do some of these, not necessarily all of them. And then do they fail to recognize phonemes? And a phoneme is a sound for a letter. So you might say to your child, which one of these words starts with the same sound as cat? And then you give them 3 words, dog, man, or car. And what you want to see is, can they tell the k sound at the beginning of cap and car are the same? Or are they not able to do that? Now, moving up to age 6 to 7, now they're about first grade age, do they still have difficulty recognizing and manipulating phonemes, taking words apart and moving sounds around? Do they fail to read common one-syllable words like mat or top or pat, or just tiny little short words? No, it would be a good one, or stop, or mom. Do they make reading errors that suggest a failure to connect sounds and letters, like no connection at all? So they're looking at the word goat and they say big. And the only similarity there is that there's a G somewhere in the word. In this case, it shows up at the beginning of the word they're looking at, but they wind up saying a word that has it at the end. There may also be no phonetic similarities at all. They could have totally different letters, which means their little mind, their little brain is trying to produce a word because they know it's a word. They know it's a real word, but they can't decipher the code to get to the word. Do they fail to recognize very common but irregularly spelled words like said, which has no business being spelled S-A-I-D, or where, or to? These are words that by 6 or 7, most kids can just look at and read. And do they frequently complain by this age about how hard reading is and refuse to do it? Once you get past 7, then we're looking, the signs then are lots of mispronunciations of long or complicated words. Paschetti would be an example. Amulium instead of aluminum, or some variation thereof, is another common one. Do they confuse words that sound alike, like tornado and volcano, or lotion, and they're trying to say ocean? It makes no sense, the things they're coming up with, but they sound somewhat alike, but it's a different word. Do they speak sort of haltingly? Does it take them quite a while to, is this length of pause longer than what you consider normal before they speak or answer a question? Do they overuse really vague words like, this stuff that, because they can't pin down the word they want to say, they say stuff, or, the thing that, they're saying thing a lot instead of naming what it is. Do they have trouble memorizing dates, names, telephone numbers? Because by 7 and older, they're trying to remember their friend's phone number at least long enough to get it into their address book on their smartphone, let's say. Do they have trouble with small function words like that and an and in? And a function word just means it holds a function. It connects words in some way or leads to words, but it doesn't really carry a meaning all of its own. That can be a real landmark for a specific kind of dyslexia, where if it's concrete and imageable, they can remember those words like dinosaur or butterfly. But those little function words that don't carry any graphic image to them in terms of what they mean, those can be harder. So do they also just wildly guess when they're hit with a multisyllabic word instead of trying to sound them out just because it's overwhelming for them? Do they skip parts of words? Like, say they're trying to read convertible, but it comes out with connable because they've left out the whole middle of it. When they're reading out loud, do they substitute easy words for hard ones? Like, they may be looking at the word automobile, but they'll wind up saying car, which is great. They're going straight from the ink marks to the meaning, which is good, but it's also a signal that something's going on in terms of how they perceive and process the written language. Do they spell absolutely terribly, even after, junior high, high school? and have really messy handwriting, which as they get older, they tend to write smaller and smaller and smaller in an effort to try and control it more and more and more, but it's not very effective. They have a lot of trouble at this point completing their homework or finishing a test on time because they have to agonize so long over the handwriting and how to spell the things that are the answers. And by this age, do they have a deep fear of being asked to read out loud. So if you want more information, we'd be glad to help you. We're at Neuroeducation. It's the Learning Clinic. There's a phone number for you to call. There's a website for you to check out our services. And there's an email address if you'd prefer to email us. We look forward to helping you and hearing from you. Thanks so much. Bye.